Great. Well, I think I will start so we don't lose any precious time. Good morning, everyone, and welcome to this seminar on commercialization of cannabis in Germany, and also how is the question of how it affects Europe and public health. My name is Emil Jaslin. I work for IOGT-NTO, Swedish organization working with alcohol prevention and drug prevention, and I'm happy to be the host and the moderator here today. To discuss this very, very interesting topic. So before we begin, I will do some digital housekeeping. So we will have for a short opening speech and then three presentations, and then we will end with a small panel discussion to go kind of deeper into the topic. If you have any questions for any panelists or any of the presentations, you can write that in the Q&A function, and I will try to get in as many questions as possible during the panel discussion. So we won't be using the chat, so that could be good to focus on the on the Q&A. So of course we won't take questions after the presentations, but we take everything in the panel discussions instead. So hopefully everything is clear, and with that, I'm very happy, and it's my honor to introduce the first speaker, which is also the host of this event, Heléne Fritzon, member of the European Parliament and part of the S&D group in the Parliament, as well as a member of the Environmental and Health Committee, ENVI. We're really happy that you're here today, Heléne, and the floor is yours.
Thank you so much, and good morning, dear all, and welcome to this seminar on cannabis legalization within the European Union. As the S&D Vice President for Health in the European Parliament, I want to highlight this proposal and the effects it could have on public health, not only in Germany, but in the EU as a whole. I want to thank our partners, IOGT-NTO, the Narkotikapolitiskt Center, EURAD, and the World Federation Against Drugs for co-hosting this important seminar today. So welcome. In 2021, the newly elected German government, consisting of the Social Democratic, Liberal and Green parties, announced that they aim to put forward a proposal in 2023 to legalize consumption and sales of cannabis for so-called recreational use. If implemented, Germany would be the first member states in the European Union countries to introduce legal sales of cannabis. A legalization in Germany would not only have a dire impact on public health in Germany, but also in other European Union countries. The presented model is similar to the systems found in a number of states in the United States and in Canada. As shown in Canada and the US, legalization leads to increased consumption, supply and commercialization of cannabis, which has a direct negative impact on public health. And that must really be clear because that is fact. The impact of narcotic substances affects not just the individual user, but society as a whole. For this reason, decisions regarding narcotics policy should not be taken easy, but always have public health and key priority. Additionally, a German legislation would strengthen cannabis drug trafficking across EU borders and cannabis consumption in neighboring member states. A German legalization of cannabis has a clear European dimension, since Germany cannabis sales needs to comply with rules and regulations relating to the internal market in the European Union. Not only does the German proposal breach the key treaties and directives of the European Union, Germany's legalization plans are also in direct conflict with the UN Convention on Drugs, of which both Germany and the European Union are signatories. I want to stress the importance of countries working together when it comes to narcotics policy, because a decision taken in one European Union member state will affect countries in the whole Union, particularly neighboring countries, of course. The discussions in Germany is something that will affect all of Europe. Drug policy does not happen in isolation, and it's likely that the German commercialization of cannabis would lead to increased illegal sales and use in neighboring member states. A key priority among European Union member states should be to ensure that no one is harmed by drugs and narcotics. Here, the European Union serves as an important facilitator for collaboration to decrease drug trafficking and smuggling. So we need to talk about how we can strengthen European public health, for example, by strengthening recovery and decreasing smuggling of drugs, rather than worsening it through policies and puts corporate profits before the health of European citizens. The purpose of this seminar is to start that conversation within the European Union and the European Parliament, because we need to act together. I look forward to an insightful seminar and fruitful discussions, and of course, a continued dialogue and work across member states and parties and governments and citizens on a joint drug policy and approach to improving public health. It's about the future for young people and for all the citizens in our European Union. So thank you once again for being here together with you, and thank you and welcome to this seminar.
Thank you very, very much, Heléne, and thank you for a great introduction to the topic. I think you covered a lot of the things we will also go deep in, but I really like your point about strengthening public health and not worsening in it. I think is a really important point here, and talking about how we can work together to decrease the harmful effects of drugs and decrease public-related harm from drugs. So that's a really great introduction. And with that, I will move into the first presenter, which is Bobby Smyth. He's a child and adolescent psychiatrist, and he has been studying the effects of cannabis for a long time. And he's here to talk about the effects of cannabis legalization, what would be the consequences for public health. So Bobby, I will leave it over to you, and I will also try to get your presentation up on the board here.
Thank you, Emil. And so my day job is working with teenagers with addiction issues, and cannabis has become a huge driver of demand for my work. So I'm really interested in this topic. So the next slide. We already know that across Europe right now, cannabis is causing a significant level of concern from a public health perspective. Among new entrants into addiction treatment, no drug is generating more demand for addiction treatment than cannabis. It's about double the demand for the second highest drug, which is cocaine addiction treatment. And the number seeking treatment for cannabis has increased by about 25% in the last decade. Cannabis can also cause acute harms. It can cause people to become very, very distressed, and some of those people will present to emergency departments. And if you look at drug-related presentations to emergency departments in Europe, the drug that features most commonly is, surprisingly, cannabis, ahead of cocaine, ahead of heroin. Next slide. So what concerns us as psychiatrists, I suppose, some of the longer term harms, particularly where people commence using cannabis in adolescence. The adolescent brain seems particularly vulnerable to adverse impacts of cannabis. It seems to affect white matter formation, and one of the downstream consequences of that appears to be increased risk of developing psychosis. So the next slide then. So when we've got a current public health problem, the challenge for us as health professionals is to figure out how can we make this situation better, and also how can we avoid making it worse. So it's definitely worthwhile looking at other countries and jurisdictions to see what policies they've employed and how they're getting on. So North America has been liberalizing its cannabis policy over the last 25 years, initially with very liberal approaches to access to cannabis for so-called medical purposes, and then formal legalization. So how's it getting on? So that next slide looks at that. So this looks at data from the Global Burden of Disease Survey, which looks at a whole range of different diseases and illnesses. This slide focuses on the amount of disability and health problems arising from cannabis use disorder globally, where red is bad and blue is good. And when you look at cannabis-related harm, the location in the world that is doing worst is North America. It's Canada and the United States across all the metrics. So next slide. Again, what concerns me, I work with teenagers, is teenage cannabis use. And the most concerning pattern of cannabis use is daily use. So again, in the United States, we see that 16-year-old children back in the early 90s, about 0.8% were using cannabis on a daily basis. That has increased by 600%, sixfold, up to 4.8% in 2019. While in Europe, we've kept the rate of daily cannabis use amongst our youth relatively low, still less than 1%. So America clearly not doing so well in that regard. So next slide. So this is data on adults in the United States, and the line to pay attention to here is the red line again. So this looks at the magnitude of the increase in the proportion of the population who report daily cannabis use in the adult age range in the United States. And we see a 10-fold increase over the last 30 years in the number of adults say, I smoke cannabis on a daily basis. And that seems to be what happens with liberalization of policy. You get a small increase in the number of users, but established users just use much more regularly, and that's associated with more harm. So next. So this is data from Canada, which looks over the last 20 years. So about the 15 years before the planned liberalization of policy, which the government there announced plans to legalize cannabis around 2015, actually legalized in 2018. And prior to that had liberalized access to cannabis for medical purposes. And across that incremental liberalization, you see a steady increase. So the orange bar there in that graph looks at the proportion of Canadians who use cannabis on a daily basis. That's increased from 1% to 6%. The gray bar looks at the number of people reporting symptoms consistent with a cannabis use disorder, problematic cannabis use. And you see that accelerating upwards, particularly in the latter phases of the policy liberalization, and particularly actually starting once government announced plans to legalize. The impact doesn't just happen after you open the stores. Once government tells people, we're going to legalize this, established users start using more and more problematically. So next slide. And this slide, I suppose, this study by Callahan looked at cannabis-induced psychosis and has actually now been quoted as evidence that legalization does not increase cannabis-induced psychosis. But if you actually look what's happening in this graph, so it looks at the weekly number of attendances with a cannabis-induced psychosis in Canada, you see it's sort of doubled over about a 2.5 to 3 year period, just prior to legalization. So that's after government has announced its plans to legalize. And the problem with this study and lots of other research is that they use that pre-legalization period as your baseline period. And then they sort of say, oh, and when we actually opened the stores, it didn't continue accelerating up at the same pace. Therefore, legalization has had no impact. But that ignores the fact that it's the promise of legalization that's driven the upward trend in the first place. So this concerns me as a psychiatrist. To see a doubling in cannabis-induced psychosis in just 2.5 to 3 years is a huge public health concern. So next slide. Next slide looks at emergency department presentations over a longer period. So you see that baseline before legalization, 2010 to 2016, where emergency department presentations, particularly in younger adults, are nudging upwards. That accelerates upwards further after government announces plans to legalize, and then remains at those high levels and jumps higher again following actual commercialization of cannabis. So you see the number of presentations has gone from about sort of 7 per 100,000 per annum up to about 35. So that's a 7-fold increase in the number of people presenting to emergency departments sick as a result of cannabis in just a 10-year period. So next slide. So yeah, and I suppose that those okay. So it's not just the individual that's affected by cannabis policy, or good cannabis policy or bad cannabis policy. Child poisonings are a particular concern, and these are one of the more consistent adverse impacts of legalization in legal locations, particularly once edible products are legalized. Sadly, these are often designed to look like children's sweets, and children accidentally consume them. So we see a surge in numbers of children presenting to emergency departments following accidental ingestion of usually a parent's edible cannabis. So next. There's also the issue of cannabis impaired driving. So if you drive when you're a bit stoned, you're more likely to have a crash. You could injure yourself or other people. And again, the study at the top of the page there by Lane and Hall looked at the states across the United States, and they found that there was an increase in the number of road fatalities following legalization, both in the state that legalized and in neighboring states in the year after legalization, an increase of 1 per million per month, which is a substantial increase. But it also occurs in neighboring states. The theory being that you sort of get some degree of cannabis tourism, and some of those tourists don't make it home. And there's data from Canada also showing cannabis cropping up more often in drivers injured who arrive in emergency departments. So next. There's also a big concern about pregnant women smoking cannabis, and this isn't really a big issue in Europe. I think women who are pregnant would sort of anticipate some degree of risk. In the United States, there's been an increase in cannabis use within pregnancy, and the bad news, unfortunately, is we know that cannabis use in pregnancy is associated with smaller babies, preterm delivery, and there's also evidence that when those children are followed up into childhood, they show evidence of developmental deviations and problems, which is a real concern. So next. So, when the United Nations very recently reviewed the evidence on this, if you look at the bottom right-hand corner there, that they made a reasonable conclusion, I think, which is that in jurisdictions that have legalized, health-related problems have increased. So next. One of the big things that have happened in the United States is potency has shot up. You get a bit of a trade war between the legal producers and the illegal producers, and that drives up potency and down cost. And that tends to aggravate public health problems because it promotes use. So next. And sadly, the goal of eliminating the illegal market or the black market, it just hasn't been achieved. And what seems to be occurring in the United States is that the organized crime groups move into the states that have legalized and become more active there, and use that as a launch pad from which to supply the states that are still illegal. So with Germany legalizing, you'd anticipate the organized crime groups will move into Germany, and they will use that as a launch pad to supply neighboring countries. And it's certainly that's not good news for Germany or anyone, I would suggest. Next. So for all of these reasons, a whole multitude of medical organizations have come out in opposition to cannabis legalization based on their assessment that it is going to increase health problems. It's going to make things worse, not better. So that includes the American Academy of Pediatrics, the American Medical Association, the World Medical Association, and the State Medical Society of New York. So next. So finally, the guiding principle for doctors is what's called the Hippocratic Oath. And really what that asks us to do as doctors is, whether we're assessing a problem in an individual or across a population, our job is to identify interventions that will make things better and also avoid making things worse. And for me, that's the reason why legalization is a mistake. It's not going to make things better, and is probably going to make things worse. Therefore, as a doctor, it's really impossible to support it as a policy approach. Thank you.
Thank you very much, Bobby, for that great presentation, and for fitting that much information into a very, very short time span. That's very impressive, and I'm looking forward to going deeper into it in the panel discussion as well, with many interesting points you brought up. And I think it really shows a really good proof on the many different aspects on public health that's affected by legalization. But with that, with no time to spare, I will move on and introduce our next speaker, which is Staffan Hübinette, who is the Senior Advisor at the Drug Policy Center in Sweden, and also a teacher in drug prevention. And I know you've also been working a lot studying the European cannabis industry and its objectives. So I'm looking forward to hearing about your findings and your presentation. The floor is yours, Staffan.
Thank you very much. I will see if this works. Yes. I will say a few words about the cannabis industry and legalization in Europe and the cannabis impact of the cannabis industry. With legalization comes a cannabis industry. And in US and Canada, we have had a medical market for about 20 years, more than 20 years, and an industry in the medical market. But now we also, for about 10 years, have had a cannabis industry on the recreational market, but also on the hemp market and the CBD market. In Europe, there is an emerging cannabis industry on the hemp market, CBD market, and medical market, but in the recent 5 to 10 years. And there is now an infrastructure of cannabis industry in Europe ready for legalization of recreational marijuana and so to speak, take the next step. I'll see if I can move on here. It doesn't work.
I think you need to accept first that you can control.
You can control. Where do I accept it?
I'll try it.
Okay, you can. We see. Can you click?
Yes, I'll do it.
Yeah. Okay. And investors are interested in making money, of course, on the green gold rush, so to speak. And Europe is a bigger market by virtue of its population than North America. And US and Canadian cannabis industry are investing in Europe now. Next slide. There are a lot of conferences, exhibitions, and fairs around Europe nowadays, about 40 to 50 annually in major cities in Europe. And this is from such a conference in London last summer. And the question is, what's in the minds of the cannabis industry leaders? Next, please. I'll just give you some quotes. We are ultimately trying to change society by bringing about acceptance and accessibility to cannabis in Europe. Next. Given it, Germany is the largest economy in Europe, we think it will lead the way and create a domino effect for the rest of the continent. Next. Germany will further become the undisputed cannabis industry capital of Europe. Next. Get ready for a cannabis boom in Europe. And next. And this is from this year's conference in early May in London. Next slide. There were about 1,500 leaders from cannabis industry around the world. And this is the message from the Czech National Drug Coordinator, Jindřich Wobor. The EU is a great idea, but very bureaucratic and in many ways very behind on this. The way forward is what we are doing. Individual states will change their laws and put pressure on the EU. Conferences are good, but we need to take concrete action. I will say it frankly, we need strong lobbying and campaigns. Put some money on the table and remove the unnecessary anxiety from politicians by educating them. And this is a message from a governmental official in the National Drug Coordinator in Czech Republic. And this is the message to the cannabis industry. And this illustrates that there is a new sort of alliance, not only advocates and organizations that we have seen before, but now also politicians and the cannabis industry work together for legalization in Europe. Next slide. And the reason for this interest for legalization is this shows the household's expenditures in Canada on the medical cannabis. Next slide. And this shows the expenditures on recreational cannabis. And that's where the big money are, of course. The medical market is limited and decreases actually after legalization. Now the EU Commission has stopped Germany's plans for full legalization. And Germany has presented a watered plan in 2 steps. And at the beginning, there is no commercialization of and sales of cannabis. They will make a trial in step 2 after the summer, but the goal is to have a full legalization. And the cannabis industry was disappointed, but they also said it's a milestone with this watered decision, because they realized that we have to wait some years before. They hope there will be a full legalization, of course. And they won't give up, and Germany won't give up their efforts for full legalization. And one of the main arguments we hear from advocates and the industry is that legalization will reduce and outcompete the illegal market. And what do we know about that? Bobby Smyth, you mentioned a little about it. But the market, the size of the market can be the use of cannabis. And here's the 12-month prevalence. In Canada, that can be a measure of the market size. And in 2012, the 12 months prevalence was 10%, and 10 years later, last year, it was 27%. Next. And 2012, the whole market was illegal, 100% of the market. Next. And today, they estimate it's between 30 and 40%, but it will probably decrease in the years to come, but not be eliminated. There will still be an illegal market. Next. In low prevalence countries, like the Nordic countries, there is around prevalence around 5% today. And 100% of that market is illegal. Next. And assume that those countries will legalize, we can quite sure say that the cannabis use will increase. And if we have the same situation as in Canada, for example, we will still have an illegal market. And the illegal market will be as big as it's now when we have a prohibition. So what had happened? Only that we have more cannabis use. Next. So what we also have seen in the United States and Canada is that it's after legalization, there is a continued liberalization, because high taxes and strict regulations doesn't work. So you need to liberalize to lower taxes, lower prices, and get higher availability to compete with the illegal market. And that will increase the consumption. So it's conflicting goals for the states. So the alternatives is not a restrictive model of legalization with high taxes and strict regulation. The alternatives is liberal legalization or a prohibition with a good prevention work within the framework of UN conventions and EU law. Next. And before I summarize, what we have to consider is not proposals today on restrictive models for cannabis legalization, as in Germany or the Swiss trial, for example. What we have to consider is what it will look like 20 to 30 years ahead. And that will be something else, because what we have seen, as I said, in the United States and Canada is a continued liberalization of the regulation. So to summarize, with legalization comes a new for-profit cannabis industry. Go on. And we will have two markets that competes, and with increased competition, you will see new products and new devices for using cannabis, and money in for marketing and new target groups, especially women. And we will see an increased availability of cannabis. And falling prices and so on, and increased consumption, and increased harm, as Bobby Smyth showed. And as I mentioned, a continued liberalization. So that's what we will see when with the legalization. And finally, the next slide. It's interesting now in the United States that after 10 years of legalization, advocates for legalization, some of them have changed their mind. They realize that this creates problems. So now there's a debate on the experiences of legalization. And this is from New York Times just a couple of weeks ago. Legalizing marijuana is a big mistake. And hopefully in Europe, we will not make this mistake. We can prevent this mistake by not legalizing cannabis. Thank you.
Thank you very much, Staffan, for a very interesting presentation and for showing us different sides, and also the kind of we can kind of snowball effect of legalization and its long-term effects on public health as well. So with that, I will go further and leave over to Stig-Erik Sörheim, who's the president at Europe Against Drugs, as well as head of the international department at the Norwegian organization Actis. And you have gotten the kind of the task to combine everything here and also tell us a bit about the German case and its developments as well. So I will give the floor to you, and you're around 10 minutes, and I'm looking forward to hearing your presentation as well.
Thank you, Emil. Will you control my presentation?
Yes.
Okay, good. Yes, you can skip to the next slide, please. Just a few words about EURAD. EURAD is a European drug policy network. We work to promote prevention, treatment, and recovery in European policies, and also on the global level in the UNODC. So, next slide, please. So, as Heléne Fritzon mentioned, when the new German coalition government was in negotiations, it became clear that they wanted to legalize cannabis. This was back in November 2021. What they were talking about was not clear. The details of what they were talking about were not clear, but it looked like they were aiming for full legalization with a commercial market and licensed shops, licensed production. We didn't have many details. The Green Party had already published a draft for a cannabis control law in 2015, so that was pretty much the only real document that was published. But there was no agreement in the coalition government. But it was very early on very clear that the cannabis industry saw this as a great business opportunity. There was a lot of enthusiasm in their publications on their websites. Next slide, please. A more detailed proposal came in October 22, the so-called Eckpunkte document, which provided more details. So what they envisioned was legal supply chain, sales through legal licensed shops and pharmacies, and they would add some typical public health measures like age limits, labeling and health warnings, advertising bans, drug driving rules. What they did not introduce was limits on THC, the psychoactive component of cannabis. Only for the youngest customers would there be a limit. And they also wanted to allow home growing of cannabis. Another interesting thing is that they only would allow domestically grown cannabis. So the cannabis sold in the German market would have to be produced in Germany. This is because import of cannabis would be clearly against the global drug conventions. But in the Eckpunkte document, they also said, we will now start discussions with the European Commission. And we will present a final proposal only after we've discussed with the European Commission what would be within the rules of European laws. Next slide, please. And I think many of us knew that there would be significant challenges for Germany when they were introducing this proposal. It's quite clear that legalization violates the UN drug conventions. On the other hand, we've seen other countries that have gone forward with cannabis legalization. Canada and Uruguay have already done it, several US states. So we couldn't be sure that the Germans would abide by the drug conventions. Germany is also part of the Schengen Agreement and the European internal market, with free movement of goods, persons, capital, and services. In principle, products that are legally marketed in one country would be legal in all the EU states. I think there would be some. It would be possible to make reservations for health reasons, but the European dimension is very, very clear. Once a product is legal in one country, it will have a significant impact on neighboring countries, both politically, in the sense that it creates a new dynamic in the political discussion, and practically, how do you prevent substances from crossing the border into your own country? How do you prevent illicitly produced cannabis from entering the market in your country? What we've seen in the United States is that the states that have legalized have become producers of illicit cannabis for neighboring states. And that would certainly be a risk in Germany as well, because it becomes very difficult to control the market. What the police in the US say that is that you can pretty much grow illicit cannabis in broad daylight under cover of the illicit market. Legalization is also in conflict with several binding European laws and treaties. The EU court decision from 2004 says that sale of drugs, including cannabis, should be punishable with effective, proportionate, and deterrent penalties. The Schengen Agreement has an own chapter on drugs that obliges countries to stop illegal export, sale, and supply of narcotic and psychotropic substances. So these are binding agreements that Germany has to abide by. And also, I think there's a practical issue for Germany. There's no way that their domestic production can supply the domestic market. The estimates now is that they produce 2.6 tons, and the demand would be 400 tons. So if you're in a legal market, there's no way that they could supply this legally without importing from other countries. And I think early on that would indicate that they would not roll out a full legalization, that they would have to go with small-scale trials in some areas and gradual expansion. Next slide, please. And after discussions with the EU Commission, they presented a new plan in April this year, and that was significantly watered down. And I think the most important issue is that they do not open up a commercial market yet. The first step of the legalization process would be home growing and non-commercial cannabis clubs. But it's quite clear that the long-term strategy or long-term goal is full legalization. So what they're doing is they're introducing trials with legal production and sale of cannabis in some areas, some cities, some regions. The details of this are not clear yet. They promised that they would come back with a more detailed proposal after summer. But I think it's likely that it will be modeled after the experiments that are going on in Switzerland currently, and that have already opened, with limited sales to some established cannabis users. So you have to be a previous user to be part of the trials, and then you get access to legal cannabis. And there will be a research element to these trials. They will somehow investigate how this works out. But it's quite clear that the research questions that they're asking are not public health questions. They are more, to see how people adapt to this new market. And the purpose of the research is to provide knowledge for future legalization. And you can also ask whether they have designed these trials in order to comply with UN conventions, because the UN conventions say that you can use drugs for medical and scientific purposes. And when you add this research element, they could argue that this is in compliance with UN conventions. And also to reduce public resistance. It's much easier to persuade the public that we need to do a trial than that we need to fully legalize. Next slide, please. In parallel, we've seen that Germany and some other like-minded countries are meeting to discuss the future of cannabis policy. They had their first meeting in June 2022. It's an alliance of Malta, Luxembourg, the Netherlands, and most recently the Czech Republic. And you can assume that this is a long-term strategy to create an alliance that could push for a change of rules. It's quite clear that Germany is much more faithful to the, based on the watered down proposal. They're much more faithful to the UN conventions and the EU agreements than Canada and the United States have been. They don't like the agreements, but they abide by them because they feel that they are so they are working rather to change the agreements in the longer run. Next slide, please. So my conclusions is that the legalization of cultivation and sale of cannabis for recreational purposes is a violation of the UN Single Convention and EU law. I would also argue that the home growing and cannabis clubs, as well as trials with legal sales, are problematic. Certainly the legal sales in trials are, I think this is a stretch of the UN conventions. Home growing and cannabis clubs, I think it's a gray area. The purpose of the UN conventions is to reduce the use of substances, not to increase access and use. So I think it's against the spirit of the conventions. The question is whether it's a clear violation. But I think we need to see that this is a first step, and the German government's stated aim is full legalization. A legal cannabis market in one country will affect neighboring countries, and as the cannabis industry was hoping for, possibly create a domino effect. And as my colleague Stefan mentioned, we do get a commercial cannabis industry, and increasingly we see that this is a driving force for legalization. It's not just activists and idealists. It's an industry that is pushing. You see this in the United States now, when the amount of money that is put into election campaigns or referenda on legalization. This does not come from individuals. It comes from industry that sees a business opportunity of expanding markets. The experience with legalization shows that use increases. Dr. Smyth mentioned several of these studies. The German government's own technical report says that cannabis use has increased after legalization, and that you would have to expect increased use after legalization in Germany. And with increased use follows increased public health risks. And I think we need to sort of emphasize that cannabis use is a risk factor, regardless of legal status or whether the cannabis is illicit or licit. Sometimes people talk about the cannabis use as a problem of licit versus illicit drugs. But the fact is that we need to prevent and limit use to prevent harms, both licit and illicit cannabis. And the way forward for Europe must be to promote prevention and treatment within the framework of the UN conventions and EU law. Thank you.
Thank you very much, Erik, for that great presentation and for concluding everything and talking about the German example. So with that, we'll go into the panel discussion straight away. And I also want to remind all the participants that if you have a question for any of the panelists or for the entire panel, you can always use the Q&A function. But I wanted to go into one question, which kind of start from where you ended, I think, Stig-Erik, is that I think one of the worries for me, at least, when I've been following the German debate, is just kind of the lack of the public health perspective in the debate. And I was just wondering, what do you think is the most worrying about the kind of debate in Germany when it comes to the cannabis topic currently? Or what do you think as a worrying trend going forward? I think it's going to be all panelists, but maybe Stig-Erik can start. And I also wonder, for all of you, kind of, how do you think this current process in Germany and the debate that has been on the EU level as well, how do you think it will affect cannabis and drug policy in the EU going forward? And we'll see if I can get everyone up on the screen as well.
If I could start, I think the German government, the government's stated goals with cannabis legalization was to protect the health of people and to prevent the black market. And I think the protection of health is an interesting issue, because what their framing is that it's the illicit cannabis that is harmful because they contain substances, harmful substances. And that might be true, but they sort of neglect the point that cannabis in itself is harmful, and that it's worthwhile preventing use, not just illicit use, but all kinds of use. I think that it's possible to set up a restrictive, public health-oriented cannabis market. But I think that what Stefan said was talking about is there will be a constant pressure because to liberalize and to soften laws, because there will be a black market to compete with, and the other stated goal is to beat down the black market. And I think that there's a goal conflict between reducing the black market and protecting public health. The more you protect public health, the more space you create for a black market. And I think the German proposal currently, I mean, the biggest weakness, I think, is that I don't see any way that this will actually curb the black market, because I don't see that this non-commercial production will really feed that market, will really be able to supply the demand for cannabis in Germany. That's my take on it.
Learning from other substances, I think, looking at tobacco, we know that as you give priority to public health measures, which include restricting access and increasing price via taxes, the black market grows. So we got to assume that the exact same phenomenon will be seen for cannabis. You cannot have simultaneous priorities of protecting public health and reducing a black market. It just doesn't, it's not possible. So the priority should be, in my opinion, obviously as a doctor, it should be protecting public health. And a black market is something, unfortunately, that you tolerate, but you're trying to minimize it, but you minimize it by reducing the number of people who consume cannabis, you're focusing on prevention. The campaigners keep using the domino effect analogy. So so there is the goal that Germany, what happens in Germany will then soften up public opinion and political opinion elsewhere in Europe, and other countries will follow. There's also domino effects that you see within countries, and we've seen this in the United States and Canada, starting off with the sort of the charade around so-called medical cannabis. That was only ever going in one direction. It's driven by the exact same people. If you look at the cannabis corporations that produce so-called medical cannabis, these are Tilray, Aurora. These are the exact same companies that produce cannabis for the recreational or adult use market, and they're also now been heavily invested in by other addiction industries, the legal addiction industries of tobacco and alcohol, who see this just as the new way of generating income from people who are struggling with drug and alcohol use problems. And again, it can't end well from a public health point of view. Is my view.
Yeah, thank you very much.
One of the great ironies of legalization is that it was one of the reasons was that they wanted to stop punishing people. And what we see now is that the legal cannabis industry is calling for increased enforcement of laws to curb the black market. So you can't escape from the control aspect of cannabis policy when you legalize. There's still a need to enforce laws to protect the legal market. So so I think it's kind of ironic, because what we're seeing now is sort of privileged PhD from leading business schools asking the police to enforce the law against small illicit businesses, often run by people with underprivileged backgrounds within the legalized system.
I have a couple of comments too. First of all, the aim for the legalization is said to be to protect youth. But what we see is that from Dr. Smyth showed it too, what happens with legalization is that children and young people get more exposed for cannabis in the home, where the parents are using edibles, for example, and can't control the children's candy and their own candy. So and that ends up with more young people at the emergency department visits. And another thing is that the advocates say that the drug policy has to be science-based and evidence-based. But what the Germans did was to make the decision before. So it was a result of a sort of political cow trade, so to speak, between these coalition parties. And after that, they commissioned a scientific overview, this technical report that Stig-Erik mentioned. And this was released just recently. And this report shows what we all know. It will be increased consumption and increased health risk and increased harm. So why, if they want to have an evidence-based drug policy, why don't look at the evidence first and then make the decisions? So this is a question about politics.
Yeah, I think that's great. And spinning off on that, I think one question I think is interesting. I know Stig-Erik mentioned that you have this kind of small coalition now of EU member states discussing how they can kind of push for legalization or different models to sell cannabis. My question was kind of, we still know that though, that a large majority of EU member states and a lot of members, EU citizens and politicians do not want to legalize cannabis. For many of the arguments that you have mentioned today, what will be your message to them? What would you expect? Because you see these member states kind of, I mean, they're out and they're voicing their opinion on legalization, but you don't really see as many people kind of defending the current system, as you say it, in that sense. So what would you kind of be your message? What do you think other member states should do, or for that matter, other politicians in Germany for that matter as well?
Well, I maybe try answering that. I suppose it's my observation of support and opposition for liberalization of cannabis policy is that the majority of people in Europe, the majority of doctors, which, you know, are uncomfortable with the idea of liberalization, but they're just sort of quietly uncomfortable with it. They're not passionately uncomfortable. All of the passion seems to lie on the side of the minority who want to see policy change. And maybe that's just human nature. People are rarely passionate about the status quo. They're more passionate perhaps about change and revolution. But the challenge for us, for those of us who are uncomfortable with this direction of travel of policy, is that it is creeping up gradually across the population and across society. People are being softened up via medical cannabis campaigns to think and be made believe that cannabis isn't that harmful. Governments across Europe, including a lot of the bodies who've got responsibility for drug policy across Europe, they all refuse to tell the public about cannabis-related harms. They're actively opposed to mass communication campaigns which would actually inform people that this drug is causing a lot of addiction and carries with it a range of mental health risks. I don't understand why governments are refusing to inform their citizens of the harm that this drug is currently causing. And I think that would dampen down some of the growing enthusiasm amongst the sort of swing voters on this issue.
I would say that I fully agree. And I also want to say that there is a risk that some politicians and political parties don't want to take the discussion on normalization and legalization of cannabis because they are afraid of losing young voters in the next election. And perhaps a way to win an election can be to propose legalization because they think that they will win the young voters. That was happened for Justin Trudeau in Canada. And once they start to campaign for legalization, as Dr. Smyth just showed, the consumption, people adapt to that, and the consumption will increase even before the legalization. So what politicians need to do is to stand up and take a fight and not be quiet. And the problem is not the advocates. The problem is the majority that don't that's not enough passionate, as you said. So we need to have a discussion on that. And also, and I will also say that countries that don't want to see a legalization and political parties have to cooperate and have alliances like these countries Stig Erik mentioned that want to legalize. So we have to organize this in some way or another.
But I also think that anybody who's been in the cannabis debate knows that resisting legalization comes at a cost. It's quite, you know, you are targeted quite heavily by activists, and for most people this is not the key issue in our lives. There's a limit to how much time we want to spend on this. So I think that it's even for governments, it's a lot of extra work once you go out and say something about cannabis harms. You're constantly questioned and challenged. So even for like or big organizations or governments, it comes at a cost. I think for me, one of the challenges is that cannabis policy, and I think this has been a conscious strategy, is not just one thing anymore. It's many discussions in parallel. You have CBD, you have hemp, you have medical use, you have recreational or adult use, and for policymakers and for the general public, it's difficult to understand exactly where to draw the line. We don't want to be irrational. We don't want to sort of, if there's medical utility in cannabis, we don't want to lose that opportunity. We want to. So, if CBD is a non-toxic and non-addictive and non-psychoactive, we don't want to ban that. But where exactly do we draw the line when we see that you can produce psychoactive substances from CBD that are not regulated because they are derived from CBD? These are new policy, new changes. Where do you draw the line in terms of medical use? What's rational? What's evidence-based and what's not evidence-based? It's quite a complex picture, and I think the cannabis policy is not just legalization. Is not a switch that you turn on or off. I think it's more like a tap that you can, it trickles under prohibition, and you can turn up the tap a little bit so the water flows more with medical cannabis or with cannabis clubs or whatever, and at some point the tap is so open that it doesn't really make much difference whether you legalize or not. And I think that's what the data from Canada shows. The very sharp increase in use before legalization was because they started turning up the tap. They stopped enforcing the laws. They expanded. I think the medical cannabis use expanded by 15-fold in just 3 years. They stopped shutting down the open sales of cannabis. So they'd already opened the tap and they legalized, and they opened one more turn, but still it was already quite open. And I think that's something we need to be aware of. It's not just a question of legalization.
And we need to define what medical cannabis is. It's approved drugs, or is it all cannabis we are talking about?
This is a good lead-in because we have actually a question from the audience as well. That is on there. I think maybe Dr. Smyth is the perfect person to answer this. Will limiting cannabis use to pain management be useful, or will it have its consequences? I think it's interesting with which is you said as well, Stig Erik.
The evidence of cannabis's effectiveness for pain is actually very poor when you evaluate it objectively, and that's not just cannabis, but even any cannabis-derived product. Like as a doctor, I think we've fought hard and we've done a good job in Europe, a decent job anyway, at regulating the pharmaceutical industry. You don't get to call something a medicine, just to stick it in a shop and start marketing at people. You can only call it a medicine if it's been approved by the European Medicines Agency, who've evaluated not just its effectiveness for a minority of enthusiastic product champions, but also its safety and its effectiveness across the population. And we do that for all other medicines, and nothing should be called a medicine unless it's passed those tests. And cannabis and cannabis-derived products just don't pass those tests for pain. Some cannabis-based products, such as Sativex, which contains both THC and CBD, has got some limited utility in addressing spasticity in multiple sclerosis. But there's terribly limited conditions. CBD, is certainly very useful for a small minority of children with profound forms of really severe childhood epilepsy. And in those cases, those products deserve to be called medicines. But cannabis, the plant, like, this isn't 1723. 1723, you go to a doctor, you'd leave the office with a bit of a plant or some potion he brewed from something he had in his garden. That's not how medicine works in 2023. I'm amazed that society is so quick to accept that a plant is a medicine, and that you'll go home, burn it, and inhale the smoke. Smoke that we know contains the same toxins and carcinogens as tobacco smoke. It's really, when you strip it back, it's amazing that people have been so persuaded that this is a medicine.
And I think this goes well into what you also said, and kind of creating complexity as well, and talking about medical effects and medical cannabis, of course, just makes it much harder to grasp, I think, which I think is, of course, also a very easy tactic that we see many industries use, kind of trying to divert kind of the evidence that is very clear when it comes to cannabis and cannabis-related harm. I mean, we see the same on how the tobacco industry has acted, for example, on tobacco as well, and how we see them act now with novel tobacco products, for example. So we are already out of time, but I will give you each just 1 minute to kind of summarize, and what would be a most important message to everyone listening on the kind of European aspect of this. Like, what would be your takeaway message? So maybe we can start with let's start with Bobby, maybe.
I suppose the people have taken the time to listen to this conversation for the last hour. It suggests to me you're already engaged and concerned by this topic. But talk to as many people as you can around you, engage with as many organizations in your own country or your own network to try and generate concern amongst your colleagues about this issue. And I think in terms of policy goals, I think we've got to advocate unapologetically for public health being given absolute primacy. Goals around reducing black markets and so on is very much a secondary goal. It shouldn't, but the top priority has got to be public health. And I just, let's not rush into anything. We know that legalization, as you see in the United States, with its gun policy, it's a one-way street. Once you go down it, even everyone realizes this is a mistake. You can't sort of put the genie back in the bottle. So let's be very careful what direction we go in.
Thank you very much, Bobby. Staffan, want to follow up?
Yes, about the genie, exactly. And there's no need for experiments and trials in Europe. We can wait at least 10 to 15, 20 years to see, evaluate what's happening in the United States and Canada. And from that, we can see what's the impact of cannabis legalization.
And finally, Stig-Erik.
Yeah, I think that the common European approach with the balanced drug policy has served us quite well so far. I would strongly advise against the countries going rogue on in this area, and I think we have everything to gain from waiting and getting more data from the United States and Canada before we really discuss this any further. I think that there's still early days in these markets, and we can learn from their experience before we make decisions that will be very, very hard to reverse.
But we have to be better on prevention. Focus on prevention. I
think that's a great final message for this panel. Thank you very much, Bobby, Stig-Erik, and Staffan for both your presentations and for being part of the panel discussion. Thank you as well again to Heléne Fritzon for her great opening speech and statement, and of course, thank you to all the participants as well who spent even more than 1 hour for this. And I hope to see you. Let's keep the debate going and keep the discussion going. And I hope you all have a great day. Thank you very much.
Thank you.